How about, yeah, we'll fun. All right, it is May 30th, 2024 at 2 p.m. in the we are in the Justice Peace Courtroom in the Ramsey County Courthouse. And I call this workshop meeting to order. Roll call.
Commissioner Cheney.
Here.
Commissioner Casterline.
Here.
Commissioner Russo. Here. Commissioner Dudnik.
Here.
Judge Garza.
Here, we've got a full court. Items for deliberation, we're here to discuss Aransas County's Texas Association of Counties Health and Employee Benefits Pool Plan year 2025 with our benefits consultant, Clarissa Martinez.
All right, so thanks. So I think some of y'all already have the information that I'm gonna pass out, but I'm gonna pass it out this packet so that y'all can follow along as well. We pulled more trees than I needed to.
They plant some new ones every once in a while.
Don't get some off my lawn.
I actually read a deal that there's more trees now than there was like 100 years ago.
This one is the packet we're gonna go. The second part is additional information, but I'll go through them. On this session. All right. Let's see. All right, well, good afternoon. My name is Clarissa Martinez. I am the Employee Benefits Consultant for the South Territory at TAC. And I'm here to present the Plan Year 2025 renewal, as well as some of the alternate options that we included for you all. I feel like we just did Plan Year 2025 before, and now we're on 2025, so it's pretty crazy.
I thought we renewed for 2 years, when's the last time?
That would be nice.
That was
We
year and a
were
half.
like 10, so yeah. So over the last, this information I'm gonna go over right now. It's not in your packet, but it is in the full renewal documents that y'all received. But this is just some statistics, things that are happening with the pool that I'll go over. And so over the last decade, the pool renewal has been below the state average for the health plan increases. So every year, just how there's inflation at the grocery store, there's inflation with healthcare costs as well. And so this year, we're looking at a statewide trend of 7 to 13% right now. So that's pretty high. When you blend that approach with medical and pharmacy, you're looking at about a 10.5% increase. Again, that's just the trend that we're seeing statewide. That's Blue Cross's book of business, and it's the statewide numbers. The good news is the pool needed amount. So every year we get together with our actuaries, our underwriters, and we set a pool needed amount. Now, what that means is it's a percentage of dollars that we're going to need to fund the following plan year. So the pool needed amount for plan year 2025 is 4.6%. When you compare that to the trend of around a blended 10.5%, we're still well below the statewide average. And so that's the good news. With the pool needed amount, not every group gets a 4.6%. We are governed by a board of elected officials. There's 11 of them, all different positions. And they do have the option to give everyone the pool needed amount, or they can look at each group on an individual basis. So when they're looking at an individual basis, they're looking at a variety of different factors. So that's going to include the size of the county, so how many employees, dependents that you have on the plan, your claims experience. So what are the claims looking like? And we'll get into that here in a little bit. We also look at high cost claimants. What is driving your cost increase? We look at age and gender statistics, as well as the geographical area and the cost of care here within the county. So when we look at y'all's individual group itself, and most of the time the board goes with setting individual allocations based on the data I just discussed. And so this year they decided to do that. And so when we look at y'all's data individually, if you turn in your packet to the third page, you're going to see a medical report. Oops. Okay. the third page is gonna be the medical report. So when we look at this, this is gonna give you an overview of the last 12 months in the data that we have for the medical plan. So you'll see the average subscribers and the members, so subscribers being just the employees. And then you've got average members, so that's gonna account for the dependents on the plan as well. You'll look at the middle column, which is the total contribution. Total contributions from April of 2023 through March of 2024 are close to about 2.3 million right now. So of course, this is the amount that we have received from you all in rates in every month that we receive from you all, totaled for the last 12 months. Then you'll look at the individual breakdown for medical paid and pharmacy paid. Those are the claims. The final column is gonna be medical and pharmacy claims combined. So right there, you're gonna see we're spending about a little over $3 million just on medical and pharmacy claims for you all. So we look at a loss ratio. Loss ratio is gonna compare your total cost of claims for medical and pharmacy compared to your contributions. So when you look at it, again, we paid a little over 3 million for you all. We received a little bit over 2.3 million in contributions from you all. And so we get a loss ratio for you all at about, sorry, 1 second, 132%. So what that means is we're paying more in claims for you all than we're receiving. Now, keep in mind, you want around a 94% to break even with the pool. So essentially what that means is that every dollar that we receive from you all, we use 94 cents of that dollar to pay for medical and prescription claims. The other 6% that we have from that dollar is going towards the administrative cost of the plan. Again, with this 132%, it's higher than normal. Y'all's last 2 years prior to the last 12 months have had better data, but this is just one of those years you're having a few high cost claimants. With the high cost claimants, we are seeing one high cost claimant that is driving your claims cost right now. Sitting at $446,000 total for that claimant, that one individual. So right now that is a condition that is going to be ongoing. The good news is for the last month of April, we haven't seen any claims for this individual, but it is something that is driving your cost on your total claims right now. We did have a second high cost claimant at $234,000 and then a third at $198,000. So these high cost claimants, again, are going to be what's driving your costs right now.
And that third one for the 198, that was almost all pharmacy, correct?
Yes, I believe
Which is
so.
unusual.
It is. And that one was specifically for hypertension.
Okay. I mean, I don't
and so-
need to know the details,
Yes,
but to have almost 198,000 in medication and $600.
for medical, yes, it happens.
Just very.
There's specialty prescriptions out there that are just super costly. Again, the pool itself is struggling with high cost claimants for neoplasms, so cancers. And then a lot of these new to market specialty prescriptions are coming out for different things. And so if, you know, it's something that we need to cover, we will. We have an outside pharmacy benefits consultant that comes in and looks at the new to market drugs. And so that is something that we do consider, but those drugs are out there that are pretty costly. So that is the medical data. What is making up y'all's renewal? And so right now, y'all's renewal, if y'all were to renew with the same plan option, so the same exact benefits on the medical and pharmacy side, is an 8.9% increase. So again, y'all data was trending high, you're getting above that full needed amount of 4.6%. Now, when you turn to the first page of the packet, this is where you're gonna see all of the numbers for the renewal, as well as some alternate. So on the first page, you're gonna find the alternate option plan proposal part 1. And it is of that packet that I just handed out. So you're gonna see your current plan year. So of course, for the current plan option that y'all have right now, y'all are paying $783.86 per employee per month for this plan option. With the 8.9% renewal, that is going to increase to $853.62 per employee per month. So again, if y'all were to keep everything as is, keep the plan option the same on the medical side, that would be the increase. The increase of that is around $70 for each employee. And then that equates to, I pulled the average of membership, based off of the last 12 months. And, y'all are sitting at about $190 increase, $190,000 increase to account for that 8.9% on a 12-month basis for next year. Again, this is based off of assumed enrollment. So what y'all have right now on average for the last 12 months. Any questions on the renewal itself before I move into some of the alternate plan options? Oh, everyone's quiet, okay.
Can you, question I have, I know y'all have had Blue Cross for a long time.
Yes.
How often do you ever shop it to other?
So we went out for an RFP actually last year for our ancillary products. We have negotiated with Blue Cross and Blue Shield of Texas, our medical contracts, the admin fees every year. So that is something that we actively do, but just as we, value long-term relationships, it's the same with Blue Cross. They're a mutually held company, just as, they are out there not to make the most profit as some of the others. And so really, I don't know the last time we've gone out to bid with Blue. We've just gotten really favorable discounts and rates from them in the past when we negotiate.
Well, do you have many? I have some things that I periodically get, like shot from my doctor, that they won't provide it for the negotiated price with Blue Cross. So they have a form that I sign and I pay the difference.
Okay, let's.
And
check that
they
for
say,
you.
well, you can either
So-
take it or leave it,
Yeah, you can always submit a claim after the fact. It gets a little bit tricky because then it goes towards your out of network.
I wonder how many, have y'all ever done any study or anything to see how often, to me, it's not
Yeah,
that,
those
it's not that
contracts
much for me, maybe $100 a year or $200 or something like that, but I'm curious if other people
Mhm.
have had the
Yeah, we
same issues.
ourselves have not done that, haven't done like an evaluation on the contracted pricing within those contracts with providers. I believe there's something in place or a committee in place that Blue Cross has to audit and negotiate those contracts. I can certainly look into it a little bit further, but,
I just wonder if our other employees and other people are having the same
Yeah,
issue.
I did have one issue in another county close to you all the other day that a cash price was cheaper than paying insurance. And so that was a little shocking to us because it didn't really make sense.
Mine, they charge y'all, but they charge me the
Right,
difference. And
right. Yeah, anytime you have a claims issue like that, please feel free to send it to Desiree and Desiree will send it to us. Y'all have an account team, so it's us, or it's me, Biral Patel, who's your wellness consultant, and then y'all also have a day-to-day contact at TAC who handles those individual claims questions, but we would certainly be happy to look into that as well.
So do y'all ever compare like to United Healthcare or?
We don't, and I will tell you that the network with Blue Cross and Blue Shield of Texas is far better than any of the other carriers.
Well, my wife has United Healthcare. Hers is better than ours.
It could be here. It just kind of depends. We've got lots of rural.
She never
counties
pays,
and-
and it may be just a plan that
Yeah,
she retired through the state system. She virtually never has to pay anything.
yeah. I mean,
I'll say that's
state
unusual.
benefit.
Her husband has United and he pays a lot.
Yeah.
He's with a
Every
large
plan,
clinic.
yeah, every plan is so different. I mean, looking at y'all's plan option right now, I can tell you this is a very rich plan.
Yeah.
So this is something that you do not see out there. A $500 deductible, even compared to some of my other counties that have, I know one of y'all's neighbor has a $2,000 deductible and they're considering increasing it this year. So this is a very rich plan, I will tell you that. So if you're able to maintain and continue with this plan option, that would be, of course, my recommendation. But I understand this is a top line item in y'all's budget, and so sometimes we do need to consider different plan options.
Actually, I'm glad you mentioned about the deductible, especially for in-network.
Mhm.
Because like you said, this is incredibly low. I mean,
Yes.
most other companies and government organizations went far away from $500
You'll
within the
see-
last 10 years or longer.
Yeah,
And I
But a
think
lot
that's
of them,
certainly something.
but a lot of them pay a lot better than we do too.
Absolutely.
well,
Not
this is
That you gotta
pension,
kind of have to weigh all of them together, you know, if you're,
Yes,
I
yeah,
mean, a lot of people work for government entities because they get benefit.
right, yes, yeah.
I think that's true. I just think that a $500 deductible in this day and age is very unrealistic.
Very, yes, I will say that there.
You don't have $500,
That
it's not.
people working here for us cannot afford to live in this county. And the last 3 people I've lost in my office is because for more money.
Yeah, yeah. It's a struggle and.
$500 is a lot of money if you don't have $500.
Is it
Yes, absolutely.
would it be accurate to say, sorry, most of the clerical staff working within the county probably bring home less than $1,000 every 2 weeks?
Yes, it's especially my 2 single moms who have to carry their children's health care.
Yeah.
I don't know how they do it.
We do have. Okay, I'm gonna be careful how I phrase this, because this is a pilot program. So we're only allowing a few counties where we are realizing the dependent cost on group health plans is super high. So what we're doing is we're launching a dependent pilot program where if the county contributes a certain percentage towards the dependent cost, then we will lower the premiums by that amount. So y'all contribute, say for example, and I need to look this up, I'm not super refreshed on it, I didn't think it would come up today. But say for example, if y'all contribute $100 towards the employee plus children. Well, then we would take away $100 additional from that to allow members or employees to add children to make it a little bit more affordable. Of course, the younger children, the more younger children we have on the group health plan, it benefits you all. County government, on average, the age is a lot higher than other, book of business organizations, things like that. So the younger lives we can get on there, the better. So if that is an option, we can definitely consider y'all for the pilot program. Again, that requires the county to fund some of that dependent cost, but it is an option out there. Any questions on that? I don't have that information with me, but I certainly can send it to you all if y'all think that would be a good option.
Good information.
I will get that to you all, and then we'll move to option 1 on the alternate plan proposal part 1. Now on this one, so I'm gonna give you just some plan differences here. Which you'll see in the middle part of the document, you're gonna see the plan details. So you'll see that the deductible goes from $500 to $750 for the individual. For family or for the out of network, it goes to $1,000. Of course, most of the time you're going in network, so that one, you don't worry about too much, but something good to know. Co-insurance would remain the same on this option 1. But keep in mind that the co-insurance max or the out-of-pocket would increase to $3,000 from $2,500. So again, just some benefit basics. I know sometimes they're a little hard to understand. Your deductible, say for example, on option 1, I have this plan. I'm paying $750 of my deductible. Anything after that falls into what's called co-insurance. So the plan pays 80% of the cost of services. The member, me as an employee, would be responsible for the other 20% of the cost of services.
If they're in network.
Yes, in network. Once I reach that 20% that I'm paying out there for cost of services, once I meet $3,000 of that, the plan would come in and start paying 100% of the cost of services.
Let me ask you a question. Is that per family or per person?
That is per individual, so per,
So if you got a family of three, that's $12,000 just to get to the insurance.
yes, it's high. So that is something to consider is that, you know, you would have to have, you would. Essentially 20%, sometimes a lot don't even reach their out of pocket because it's usually higher. But that is something to consider. You would go from 2,500 to 3,000 on this option one. The deductible, the copay, so for primary care and specialists would remain the same. So primary being at 25 and then specialty being at 35. The only copay that would be changed would be the emergency room copay. I know it's a struggle here for emergency rooms, so this could have an impact on your employees. Going from $100 to $150. The prescription plan would remain the exact same, so there wouldn't be any changes to the prescription plan. Now, when you look at option one, going from the current plan year to option one, you're looking at about a $43.40 increase for the employee only premium. So that does give you a kind of an idea, and I believe on Desiree's sheet that she handed out, she also totaled the amounts, the blue and green charts. I didn't know if that was yours. And so for alternate option one, again, the 1,100 non-grandfathered plan with specialty, she's seeing an increase per year or on average based off of enrollment of about 118,000. So that would be an increase onto the budget, what y'all are paying for now. Again, when you compare that from y'all's current plan of what y'all have right now, being that an 8.9% factoring, being at 190,000 versus the alternate option one, you tweak the plan design a little bit, it would be an increase of 118,000 roughly. That's an estimate.
So savings of a little over 70,000.
Yeah. So option one, I provided two other options, so option 2 and 3. My recommendation to almost every group is not to go overboard on increasing or altering the benefits. So if y'all were to make a change, my recommendation is you start minimal and go to option 1 if there is a need for change. On the second page here, the only difference, these are the same medical plans, exactly the same, but I did tweak the prescription plan. So on there at the bottom of option 1, 2, and 3, you're gonna see that the prescription plan would have $100 deductible. So essentially what that would mean is the member would have to pay that $100 deductible before paying for any of the co-pays that you would pay for tier 1, 2, or 3
And
level.
that would be per person as well?
Yes. I believe it's 300 for family, yes. And so that, and I will say this second page mainly was for illustrative purposes so that you can see the impact that tweaking the prescription plan makes. It's fairly minimal. So for example, option 1, when you change from having no deductible on the prescription plan to having $100 individual deductible, you're only seeing about a $7 difference on the employee only premium. So essentially on part 2 of this, with tweaking the prescription plan, it's really not going to save that much money. You're going to get lots of member noise versus that $7 that it takes
No.
to tweak.
Okay. The $7 is per prescription, or is it per year or per month?
Per month, per employee,
Okay.
yes. Yes. But keep in mind, tweaking the medical is one thing, right? Tweaking the prescription plan, you're messing with people's prescriptions if they need. $100 is a lot. $300 is a lot for a family if they have dependents. And so having to have them pay that additional deductible on the prescription side, you're gonna hear member noise. So Desiree's office is gonna hear it.
Well, for the deductible, you're gonna have member noise.
Yes, you will, but increasing it by $250 is pretty minimal. There's been other groups out there that have increased significantly from one plan year to the next. So,
For a single mom of three, that could be over $1,500. I mean, it's almost
Yeah.
$1,000 a year.
Yeah.
And when they're barely making it to start with, that's significant.
yeah,
But that's only on some things, if they're doing
right,
annual wellness checks.
Yes.
Or if they're going to the doctor's office, or if they're seeing a specialist, they're paying those co-pays.
right, correct.
And that's a flat amount, that is not
Right, this
going
is
to be
only.
calculated into the
Yeah.
deductible.
So deductible is only gonna be needed for things such as lab work outside of an office visit. If they're just going in for a primary care physician office visit, they're paying that copay of $25. They're going to a specialist, maybe a cardiologist, they're only paying a $35 copay. Anything outside of a visit is what's considered, you have to meet your deductible. Another thing is with all of these plan options, preventative care is still covered at 100% and the copay is waived. So,
And that's what I think we really need to push to our employees.
Yeah.
And maybe you have been doing, I mean, I pushed it when I was here, when I left, it fell by the wayside. And maybe you picked it up, but
I think,
I had no problem telling people when they were hired, get an annual checkup, it's
Yeah.
free.
and I will tell you, I think we've had discussions at our mid-year review and with Bureau. So Bureau is the wellness consultant. She is kind of in charge of this, but we do have a county-specific incentive program where it's plan design options where you are to implement, say, for example, if you go get an annual physical, we'll give you 8 hours of PTO. If you go get an annual physical, if you don't go get an annual physical, we're gonna charge you $100 that year.
Do we have data that tells us, what percentage of employees have met their deductible?
I could pull a report for y'all I don't have it with me, but I certainly can pull a report to reflect that. I can do deductible and out of pocket to get, to
That'll be
flip
good, just see what percentage of employees, that'd be interesting.
But I think it's critical, we emphasize staying healthy.
So, yes, and so essentially, the wellness program exists as a risk management to your claims. People aren't going in to get their annual checkups. What if we're missing a diabetes diagnosis and then 2 years later, they need an amputation? That's gonna be really costly to manage and, a claim. So that is the reason for our wellness program. We do have county-specific incentives, as I mentioned. They all of the designs tied to an annual physical. And with that annual physical and that county-specific incentive, we do give reward dollars back to you all to use to reinvest into the wellness program. So I believe, Bureau may be in contact with y'all already, or maybe not. But we could certainly explore that option, and that is something that's, in the renewal packet if you're interested or not. And she can come out and present to the court some different options, things like that.
And it also reduces sick leave, so, I mean, it's just better all the way around.
Yes, I would have to agree. So any questions?
So if we stay where we are, we stay with the $50 deductible, but we increase what?
500. Mhm.
Okay, 500.
Mhm.
Okay,
So I've got a question not related to plan. Does TAC, you have a plan for when retirees get to Medicare age where they can
Yes,
through, because they worked at the county, they can buy a supplement plan
yes.
that's competitive to like AARP or anybody like that?
It's pretty costly for the amount of benefits that you receive. So I haven't gone further with it.
So
To get a
we,
Medicare supplement through TAC,
so we
Yeah,
have
or
a
you-
County Choice Silver program. So we offer 3 different plan design options. One is just your Medicare sup. And then we also have an Advantage program. So there's 3 options that the county would choose from. Essentially, most likely in y'all's handbook, you have like a stipulation, if you work 10 years, 15 years, 20 years for the county, then you're offered this supplement, or you're offered the Advantage program. A lot of counties just offer it to the employee upon retirement, for them to pay for
Now,
themselves.
my thought would be, is it competitive to like AARP or
Yes.
some
our
of the
rates-
others that somebody can go, if they're not competitive, there's no use doing it, but if,
Yes.
you know, being as large a group as TAC has, you would think that,
We did just go out for RFP on this 2 years ago and our rates are significantly lower than the open marketplace. I'm happy to provide some information on that as well.
I just thought a
Yes.
cost to the retiree that they're gonna buy it somewhere else,
Yeah,
if they can get it through y'all
Yeah.
because they retired from here,
yes.
doesn't cost us anything, it's.
Right,
something that-
exactly. They're billed. It's just a program you would offer. Yes.
So unless we adopt that in our renewal, that's
No,
not
so
something
that's
we can
totally
take.
separate today.
Okay,
So this is just the group health plan, through Blue Cross.
okay.
Yeah, I would think that would,
County choice.
kind of like when you have the health fair deal where you get have the option to get the extra things, that
Yeah.
would be.
So this would be County Choice Silver is a different program. Again, enrollment for that is October. Renewals for that go in August. But that's a totally separate program that does not impact your health insurance
Okay.
rates.
But I'm interested. in
Okay,
that.
yeah, I will send y'all a County Choice Silver packet, for each of y'all. Any questions on the group health plan? Which this does allow pre-65 retirees to stay on, just as a fair warning. What else?
Yeah,
Any other
because
questions?
we've never changed our handbook to change that. Am I right?
It was changed,
I don't think.
because when I was here, we didn't allow people who
Right.
left to get on the county's insurance until they turned 65 and get Medicare.
Yes,
Later it was added, but then after I came on court, we changed it, so they had to be vested and
Yes.
retiring from the county. It wasn't like they could come in,
Yeah.
they worked for the
Yeah.
years, so we did change the handbook.
same probably
Limited to some extent.
But
And
we
then
do
yes,
have
to
people,
about-
but
No,
we do have people in there that worked a lot of years that were paying their, I don't know how many it is, I don't think it's that many.
Yeah, and it's only until the age of 65. Once they turn 65, they come off of the plan. With employees that are at the age of 65, we get this question a lot, but the employees that are actively working that are age 65 and over, even though they're Medicare eligible, the county group health plan would be their primary insurance, and then Medicare Part B, I believe, would be their secondary.
unless you choose to go.
Yeah, if you do that. Which some people are, yeah, they don't, yeah, it just depends.
But I think, cause I asked Desiree this morning, and I think she said there are 9 retirees
Yes.
currently on them. And just to remind everybody, what that means is they're paying what the employees are paying, which I think is $60 a month. And the county is paying the other $723.
Yeah.
Per month, per person.
Yes. And that is something that you can modify and change, would require a handbook change. But that is something that you can change with the renewal. So it can't be done mid-plan year. It has to be at the renewal because we program everything into our system.
What's the renewal date?
So the deadline to return the renewal for the group health plan is June 28th. And then the effective date would be October 1st. So that's when the plan starts over. The rates, the new rates that y'all have would start effective on that date.
So we'll just vote on this either on the 10th or the 24th.
But it seems strange that we wouldn't have this come due with our budget.
Yeah.
What, is there some process that over a period of time we could move it to where it's January 1st instead of,
We do discuss this during our.
I know we
budget
discuss it, but the plan
But with
still,
the dollar amount.
yeah, you're still putting 2 years budget kind of together.
When
So,
y'all-
I mean, if over a period of time, you could move it where it ended the first of the year. That, to me, that seemed like,
There's a lot
So-
of counties that do the October and September also,
Yeah.
so.
well, maybe they have the fiscal year that time though. Our
Well, that's
fiscal
their
year,
Fiscal year, and I don't know if that's why.
So
Pat
here's-
does it or not.
here,
That's the
I will
fiscal year.
say about 80% of our groups have a 10-1 effective date. A lot of them are meeting in June and July for their budget. Being a 1-1 for y'all calendar year, you are able to move your anniversary date, so you could, it gets a little hairy. Could have like a long plan year, and then we could start you over on January 1st. That way it aligns with the budget. But again, I mean, that is something to
I
consider.
mean, right now, to me, at least, my logic,
No,
I'm
you
not
do.
an accountant, but
Yes.
Yes.
When I started
What
here,
happened?
the commissioners court, I guess, who made a decision because they used to do the renewal. So Tana was, you
why
know,
wouldn't,
in
why
like
wouldn't we have?
October or
Yes.
so.
We did.
And the year that I
Yeah,
started,
because
they
it
were
came out-
moving back and we were going to do it.
What
as
would
a-
be the reason? I mean, I was
You were
getting there,
in court.
I was on it, but why would we have done it?
I feel.
I mean, what is the reason unless somebody, look, auditors or somebody asks us
What
to?
I was told by the auditor and the treasurer is that it was going to provide better budget numbers for calculating the budget for the next year if we knew what the rates were.
Oh, well,
I was told we were being forced to.
No, you,
No, it was your.
You can move.
Choice.
it's hard to move an anniversary date, I will tell you, because you then have to factor in 3 extra months of a plan year. So now you're,
This is so odd to move away.
The
from
actuarials.
You know, not, right now, what we do is we calculate 3 months at one rate and 9 months at the other rate to do our budget. And we have to do that to make.
just seems strange to me.
yeah. Well, that is something to consider. If we need to change your anniversary date to 1/1, we certainly can. We would just need some notice, and I would have to get with our underwriters.
Sounds like maybe we wanted to save 3 months is what the deal was. It would work the opposite. If you change it, you're gonna have to budget 3 months more.
Yeah.
So maybe at the time we changed it, we saved 3 months in the budget.
Any other questions? I do owe y'all a deductible report, so I will pull individuals who have met the deductible by age or by paid band, so it'll be like from 0 to 250, 250 to 500, et cetera, all the way up to the out of pocket.
I don't understand what you just said, I think.
Sorry, I'm probably thinking in my
I
head.
paid them 0 to 250 because
Yes,
our deductible now 500.
yes, but you'll be able to see who was approaching the deductible
Okay.
up to 250, from 250
Just be seeing what the
two fifty
deductible
to
is.
500
Okay.
and so on. So up until the out of pocket, that way you can see, okay, where are individuals falling?
Okay,
That way kind of gives you an idea. If we do go to the 750, then you can kind of,
That's why I'm curious, the 750 may have a negligible effect depending on what
Yes.
percentage of employees
yeah,
are reaching the
Yes.
peak right now.
absolutely. I can pull that report and then I'll get y'all County Choice Silver information.
Send that to them, because I do have it.
Oh,
That
you do?
saves you
Okay,
something
yes,
on your
that
to-do
works.
list.
Okay. Yes. Any other questions? I know it's a lot of information, hopefully I explained it okay, but if you have any questions, I don't know.
Other questions?
Oh, I'm sorry, sorry. One other thing I forgot to mention, y'all, this isn't as important to the budget, but just something that is also in the renewal. It's going to be the dental. And the dental increase is gonna be a 2.1%. Again, the dental is voluntary for employees, so they're just gonna see a very minimal increase. On the dental side, the voluntary vision has no increase. So just
I wonder how many dentists that are close to here participate in the.
well, Schultz does.
Yep.
I
Yeah,
think it
and,
was, the decision was made last year to move to us.
Bills this as well.
And I think it was a little bit better of a network than what American and Whitehall.
Yeah.
Okay. Okay. If there's ever a dental provider that's not in the network, please reach out to me. I'm gonna give you all a business card, but that way we can reach out to Blue and their network management so that they can reach out to that provider.
yeah, my dentist is,
Yes.
so
Does it work off of our same card? Cause I
Yeah.
know
So
there's
if
something we have, there's the
Vision
difference of paper card.
you, so if you have the dental, if you've elected the dental insurance, that'll be shown on your medical insurance card. So that will be medical, dental, and your prescription coverage. Vision is different. The only reason, vision, when you elect it, they send you a, Siri heard me. They send you a paper card upon enrollment. A lot of people just chunk that because they thought it was junk mail. You don't need a vision card. So if any of your employees are asking, you don't need a vision card to see a vision provider. You just want to make sure that the providers in the IMED networks, IMED, that you can give them your driver's license, which has your date of birth, and they can pull up your information.
Well, I know the one that I go to, there's some of your vision that they charge, that the medical side pays for.
Yeah, so you get with the medical insurance, you get one annual eye exam at no cost, as long as you're going to an optometrist. That's like a PCP essentially equivalent. If you're going to an ophthalmologist, which is a specialty eye doctor, that's gonna be different. So you do get one free annual eye exam.
I do have a question on the rates. So right now, the county takes 723.86 for the plan, whether you're an employee. Yes. Are we able to make that rate different for yes here? Okay.
Yeah, you can change that, but
No?
No, then that means we're paying part of the code and then cover it.
I'm saying if we were to eat the total cost difference for the employees so that nobody's rates increase.
well,
And
I
that would
did.
change the dollar amount for employer, for things.
I did do a quick calculation too here, while we're discussing this, and if we did keep the county paid amount the same at the new rate of $793.63, that does provide, the increase would be $164,936 and not the $190
On option one,
on your
Or renewal.
800, yes,
Okay.
your,
Okay.
exactly. So that would essentially be our, what we call our MCO amount.
Which stays the same because that's the employee or. If you change that and pay more on each one of those tiers, then you're paying part of the.
the difference.
Dependent,
The dependent coverage, you're paying
And I
part of the
don't, we
dependent.
don't provide the dependent coverage.
If we wanted to, we could.
Yeah, you certainly could, but that is just.
That would be commissioner's choice.
I don't understand what you're saying, so you probably put it on paper for me.
So,
Couldn't keep up with everything.
so right now we all fund the 783.86 for all tiers. So for
What
example,
we fund that less $60.
Right.
Employees pay 60.
oh, I see, okay, okay.
So we
So
pay
you want to continue that
723.
723, okay. So,
For every one of these.
yeah,
Groups, every.
But what Desiree was saying is maybe we could pay more
A
if
little
they have dependent coverage. Like if we,
to take away their 8.9%
Okay,
increase
I see.
but
on top.
Just keep the employee flat.
And that full increase.
they'd be paying the full increase for the dependents, yes.
So if we take this in, or when we take this into Commissioner Court, we would, that's actually two different items. Would be, one is to agree to the increase, and then the second would be to agree for the county, or to propose that the county pays the increase for the employees.
For the dependents.
Well, you have, I'm assuming you have each one of these different options.
Right, but one
You're
of
just gonna vote on one or the other
As well.
unless, yeah, like say,
So if
like
that is
people.
something you're interested in, we can certainly do an illustration for you. I would need to know the court date ASAP that y'all are gonna put it on. That way. we
I'm not
can-
interested.
Kind of like Bob, I'm not
I think we're
understanding.
Going to be hard for us to have enough money for insurance as
For
it is.
even out and even.
But I'm one voice. I'm just saying,
I would say the 8.9% increase, and I'm guessing that salaries increases are going to have to be a hard fight as well. And they did not get a cost of living raise last year. They got, most of them got their 2.5% step increase. And now we're gonna add almost 9% cost to them.
wasn't Nicola given last year?
No, it was not.
Only to the.
I think if we're going
I
to
get
look
that.
at these increasing their costs dramatically
Which is.
for healthcare, then we need to look at an increase in salary.
Well, we're having a salary survey, RFP considered.
But it
We
will
just-
not be done in time for budget is my
Well,
understanding.
that's very true. I mean, we're probably gonna make a selection at the next court, maybe, and then we'll see how that goes. But that's usually, I mean, I was one of the raters, and I think it ranges from a 3 to 6 month process.
Yeah.
So, right, it will not be done in time.
Yeah, there's some other counties that have been doing it, and I would say it takes a quick long.
We're basically telling our employees you're gonna be taking 29% less than you were last year, and their costs have gone up dramatically to live.
And I know we're all responsible to taxpayers, and this is probably down the line, but we do need to be conscious, I think, about the large percent of employees that basically take home less than if you were working at Whataburger or Dairy Queen.
Yeah, and
And when I'm saying that it's skilled workers, I mean, these are, people that are clerks in these different offices that have specialty jobs, and we need to keep that in consideration, because I know we have lost some employees in the past year due directly to salaries, so they have,
Yes.
we need to find the best balance for the public, for our taxpayers, and for our employees.
So were any of the counties that are doing the surveys in our proximity?
I believe Live Oak County just went through one, Matacorda just went through one, I believe, or it might almost be completed. I'm trying to think off the top of my head, because that has been a topic too. I think those are the two that I remember right now.
Maybe we could get some information
Yeah.
from some of them.
And I just want to add a point. We've been doing exit interviews since I've started, and almost every single one of them say what can kind of do better is pay.
Mm.
So that's almost everybody that.
And just a reminder, to train someone, even though there's not really a dollar value, while somebody's training them, and in my office, it takes 6 months to learn what you don't know. I've got somebody who's spending 75% of her time this week trying to train a new person. Next week, it'll still be 75%. It'll be 6 months before she's working completely on her own. There's a huge dollar cost to that for my office. There's a huge cost to what we can and can't get done because she's so busy training the new person. These jobs are very specialized. There's a lot of information. There's laws to learn. There's the language to learn. And there's a huge cost to our county with this turnover rate.
There's a huge cost for recruiting too.
Yeah.
And a lot of employees have to be bonded, and there's other
Yeah.
financial considerations.
They have to have a federal background check to work in my office. They have to have the computer skills before they walk in. I don't have time to teach computer skills. I don't have time to teach customer service.
Your point is well taken.
Thank you. All right, any other questions? Dalton? I'll entertain a motion to adjourn. Sorry, Desiree, did you have anything to add?
No, not right now.
All right,
Need to adjourn.
motion to adjourn.
Second.
Commissioner Cheney,
Aye.
Commissioner Castleline,
Aye.
Commissioner Russo,
I
Commissioner Dutton,
Aye.
Judge Garza.
Hi, thank you all very much.